everyone. Delbert, are we on? Okay, wait. Just like a production studio, we also have our cable signal over there. We are on the air. So thank you, Commonwealth Healthcare Corporation, for being here and for making the time to do this presentation on the 988 suicide crisis lifeline. Present with us this afternoon, to my right, we have Representative BJ Attal. I am Speaker Edmund S. Villagomez. And to my left, we have from Precinct 5, Representative TJ Thomas John Magnolia. And next to Representative TJ is Representative Malcolm Omar, the chair of our Health and Welfare. And to his left is Representative Danita K. Yanktamai, Precinct 3. And with that, we also have some members from some staffers also in the gallery that want to learn about this, the information that you are all about to present. So the floor is yours, and welcome once again.
Thank you. Thank you, everyone, for having us. My name is Lorenza Smith. I am a 988 crisis responder, and here with me today is the 988 program manager.
Havade Tito, Fred Fatilofa, as the program manager for the 988 program under the Community Guidance Center with our Commonwealth Healthcare Corporation.
Okay, so what is 988? Have you guys heard about 988? About the 988 Suicide and Crisis Lifeline? On the radio, what did you hear? It's a catchy. Okay, yes, if you're going through any type of crisis, to call that number. Who else has heard about the 988 program? Okay, so that's why we're here today. We're gonna share information about the 988 program. So what is 988? 988 is a 3-digit number that connects you to trained crisis counselors or responders 24/7. You can call or text the number 988. You can even chat online. You can go to Google and search 988 chat, and it'll give you the link to do that. Okay, so how our calls are routed. Or we'll talk more about the 988 program. 988 provides free and confidential emotional support to people in suicide crisis or emotional distress. It is funded by the Substance Abuse and Mental Health Services Administration, or SAMHSA, and administered by Vibrant Emotional Health. It is made up of 200 independently owned and operated local centers, including the one here in the Sinamai. The 988 Lifeline was designed to connect callers and local crisis centers based on the caller's area code. Okay. So what happens when someone calls the Lifeline? When someone calls 988, they will hear an automated greeting message that features additional options. So you'll hear a little music in the background, and it'll give you options. Press 1 to be connected to a veterans crisis line. 2 for Spanish, and 3 to be connected to the LGBTQI+ youth and young adult crisis line. If the caller does not press any prompt, they will be routed to their local crisis center based again on their area code. If the local crisis center is unable to answer the call will be routed to the National Backup Network, where they will be connected to a crisis counselor or responder. So here in the Sinamai, currently we're operating 7:30 to 7, right? 7:30 to 7 p.m. Calls after that will go to the backup center. So So even though we're closed here, someone is still going to answer your call.
Is that in that LIFELINE?
Yes, the backup center after 7 and on the weekends. So when someone uses the 988 Lifeline chat, if you're going to use the chat feature or the text feature, you will first complete a short survey, letting the crisis counselor know a little about your situation. Then you will see a wait time message while you're connected to a crisis counselor. Text and call for 988 is free. If you're using a prepaid number and you're out of load, just like 911, if you dial 988, you won't be charged and it'll still go through, or text. Okay. Okay, so who can call 988? Anyone in need or who knows of someone in need of assistance with behavioral health related problems, someone who is going through mental health related distress, whether that is substance use crisis or any other kind of emotional distress, or someone who's going through any suicide ideation. 988 is available to everyone, regardless of immigration status, religious, race, culture, or disability. The information you provide is 100% confidential. We'll save the questions for later, no? Okay, so.
So just to highlight why we have 988, Congress in the mainland, way back in 2000, where we had that suicide prevention line. Some of us may be familiar with the 1-800-273-TALK. So the Biden-Harris administration recently, 2 years ago, kind of allowed for like a restructuring or revamping of that prevention line. And so why we have 988 provided for all of our 50 states, including U.S. territories and the Commonwealth. So it's mainly, like what Lorenzo has mentioned, it's a 911, but more so for our population. And we know we all experience some form of crisis, but more so in the area of mental health. We face some kind of trauma, comes in different ways and forms. And more so with our island cultures, when it comes to mental health, it's still a very hard matter to, even though we have great resources, we have a lot of grants, funding, programs that do come through the Community Guidance Center, but it's still a very, very sensitive subject matter when even just hearing the word mental health. And I think just our island way, I think across the Pacific, right, even prior to any of this, I would say Western practices came, we had our own way of remedying, whether it's with our own family, right? We don't talk about our problems to, it's something it's always handled within our homes, handled within, and so reason why we have 988 now, now with, of course, the change and with changes in generation, right? We do see a lot of challenges, even post-pandemic. We've seen the rise in different mental health disorders, whether it's depression, anxiety. We have our veterans, our servicemen. We even have our first responders, in being impacted, right? Even we've just gone through two, in my time here in the CNMI, major, natural disasters with Typhoon Sodolo, Typhoon Yutu, and then the pandemic, right? And so that has really, in a way, impacted us. And some of us, and we always say it in our island, we're very resilient people, but still, there is still others, that kind of need that maybe higher level of care. And so why, we have the Community Guidance Center and why we have another resource, 988, that can provide, those, the services or even maybe the expertise. I'm saying some say, really, but just another resource to help with our community in the areas of mental health and even as well substance. We see that on the rise again, the substance challenges within our community. So we know, there's studies say, right, and when we talk about suicide, when we talk about mental health, the impact, right, of mental health, and I would say that's the extreme of it is suicide thoughts, and then the risk of behaviors or attempts, right, which can lead to fatal results. And so we know that with what we provide as a crisis responder, and as the data has already been shared, we know the studies say that more men or males do die, by suicide, and this we're talking across the world. This is a World Health fact that's known. But even though the studies say more women actually attempt, but more men, do die by suicide. And even if we look at, we don't have that available, but with our local data, in previous, and we could just go back to 10 years, and we'll see suicides that have happened in our Commonwealth and all three islands. That data or that fact of more of our suicide deaths are of course male. And so the data that we have and things that we see, and even with the services that we provide, and even those that do reach out to 988 and even to the Community Guidance Center, it's still like I say, why not just 988 as a gateway for our community to call, and to, as Lorenzo said, it's something that's very confidential. Even the system that we use, we don't capture any information. It's only at the discretion of the individual that does reach out. If they're more trusting and needing that high level of care, then we can continue the services that we provide. So I think one key thing that why we want to just share 988, and I think Community Guidance Center as well as a whole, with the prevention work that we do and some of the intervention work that we provide as well. We have a lot of as well suicide prevention training that we have provided for our community. Since I've been part of the suicide prevention for the past 7 years, there are trainings that we do provide, more in the form of like a CPR, first aid form of training. We do have those available, and and if needed be for here in our legislators and with the staff that are here, that can be provided for you. Next month, September, is always our suicide prevention month. We're always thankful. I know we always get great support from our Speaker of the House and all of our House representatives that are here. We're always thankful for everyone that does come out, that we highlight that. And so not just that, but then also on top of that, there are trainings that are provided that does give you a certification to provide, that form of, for us, it's really just to be able to respond and just point them our way, or just help, our community. So it's really key, right, that we can be that caring human being, that we know signs and the symptoms, right? The differences between the signs and the symptoms. I know these are very clinical words, but does anybody know the difference between a sign and a symptom? I know this is not biology class or clinical class or medical schools, right? So signs are usually things we could really see, with our physical eyes, and then symptoms sometimes it could be, when we're noticing a change in one's behavior, right? Someone, a coworker, spouse, a best friend, or just someone in the community, you just notice, they're not themselves. Maybe like we know in our workplaces, in our team, we know when someone's not really themselves. They're maybe going through something, right? Maybe issue at home, relationship thing, maybe It could be, some form of trauma, right? And maybe the impact of a loss of a loved one, or maybe some, we're seeing it. I mean, some financial challenges, things like that. That it's very, very sporadic, and it's very, we can be impacted. And so the symptoms, it's always key if we notice it, and especially for the long periods of time, then it's very important that if we can just reach out, maybe even just so, like I said, some of these trainings can really help us and really how we can respond. But if you're not able to, that's like we always say, it's always best that, and we have at times, someone will call 988 just to inquire and just to ask, is it okay? And sometimes someone has reached out to us that we can respond. We have those are the 3 phases that we are working on in these coming years, that someone to call, someone to respond. Call center, as you know, that we are hopefully crisis line, but just with the manpower, and hopefully even having it available for even our Tinian and Rhoda. Now we do just hired on individuals that can really respond for us while in Tinian or Rhoda. But those is I guess for us it's providing the safety net for individuals who may be impacted or traumatized or going through a crisis. So warning signs, right? Sorry. Yeah. So there's a whole, like I was just mentioned, right? Different examples, and for many of you, it's obvious. Probably some of this, is obvious to us when we notice certain warning signs in an individual, right? Changes in their moods. Like I said, maybe their appearance, right? Things here. There's a whole list here. But sometimes it won't be as obvious as well, right? Sometimes we're not even going to hear the words, maybe they're not verbally. Maybe it can be something that just say, "No, I'm just so tired. I'm just so sick of just don't want to be here. This life sucks." Sometimes hearing those kind of things can really should sometimes doesn't necessarily say that they're in a bad place, but it's always good just to show concern or for us to respond. And like I said, if you're not able to, it's always good. Just try to call 988, call Community Guidance Center, or find a trusted individual, right? Someone that can probably provide that response, even more so, like I said, reach out to the Community Guidance Center. So yeah, like as I said, right, there's many factors that can play into why puts one in a place of form of crisis, a trauma situation, right? So it's important that we, like I said, what 988 hopes to do is that we want to just provide information, provide not just that, but even provide some of the resources our crisis responders have gone through a rigorous training on the system that we use, but at the same time, the referral system that we have with the Community Guidance Center. I know it's not perfect, the system, but we're managing and doing the best we can just to provide that high level of care for those that do reach out and for those that are needing that support. So most times, right, like I said, you know your limit. I know my limit and what we can do and we can provide, and when we may need that individual to be referred to maybe that high level of care, whether it's seeing a professional, whether it's a therapist or a psychiatrist or psychologist, because those are the individuals with those letters next to their names that can really diagnose, right, whether someone really is, dealing with anxiety or mild depression or severe depression, and the other ones that, right, they can really engage whether there may be need of medication and that level of care. So it's really important, right? Like I said, if we recognize it, if we see it, and to say, it's, and sometimes even for a lot of us, safety, like the safety aspect, your safety could be at risk, and the safety of the individual or even others around. And it's very important, right, that we reach out, whether it's 911. That's our go-to right now. That's our protocol for us with the mobile crisis tool, trying to be put in place is that we're trying to work with our first responders, just to have that working partnership, but more so they are the go-to for providing, bringing them to the place of safety for now, right, the emergency room or the psych units. So they can be in a place of safety while they, maybe they're intoxicated, maybe there's some injury. So we want to keep them safe, and then we can provide the follow-up care for them. So yeah, how can we help, right? How can you and I help? It's very important that we ask the question, right? We ask. Sometimes we don't just go ask them. We don't go direct to like, oh, you look like you're thinking of suicide, or you're maybe. No, we just want to ask you, you doing all right? Things going okay? We need to talk, right? And so it's really good just to, and as well the way we approach, right? Just to be there in a way that we can. But like say, in our workplace, or sometimes we're all busy, then maybe if we can find someone else that has the time, or like I said, or you can always reach out to 988. So it's really important, right, that we want to keep them safe is important things, right? And also that we want to help them to connect to the resources, what other resources available, and then more so allowing them to have that decision, right? It's not really saying, okay, we're gonna need to bring you to ER, we need to this and this, but sometimes we just want to get that from them, that trust from them, that they're going to be okay for us to maybe call somebody or go to a certain area or a certain place where we can provide that level of care for them. And then, of course, it's always key, like what we do, even with crisis response, always to do a follow-up. So sometimes we want to always check in with the individual. Maybe if they've agreed to go to see the doctor or schedule an appointment with a therapist, but it's always key, we want to just follow up with them, check in with them. It's one thing that we always want to do. So, of course, one thing that we always ask for individuals is like really looking what works for them. And sometimes, when we're responding and providing, sometimes, that individual already has something that's really been helpful for them, coping skills. And sometimes it may not be a healthy coping mechanism, but we want to always make sure that, we provide safety for them, but at the same time, what is able to help them, through, we try not to others. Yes, of course, obviously, alcohol or recreational, medicinal, herbs or natural resources we have, but we want to, for us, it's really the safety aspect for that individual. And the community guidance center, we always want to, provide what else can be, just finding that trusted social support or the other hobbies or other recreational activities that that is available in the island, something that they used to do that they haven't done in a while, playing a certain sport or, certain things with our cultural aspects. So, it's always finding things that really can be that support for them. So even for us, it's important. We're all busy people, and I know with our representatives and everyone here, we're all busy. We have a lot, and after when we clock out, there's two other things that we're all So it's always good that one key thing we always do, and we always mention a lot in our line of work, is self-care. What we do to take care of ourselves. Sometimes, like I'm one. It's not a healthy option, but it's always best that we always find something that we can to decompress or de-stress. It's very important for our health and our well-being. Any questions before we? Yes.
I recently, I'll say like sometime last year, I spoke to a group of students, mainly from high school. And one of the concerns was a lot with to deal with mental health. Um, and I know, like with us growing up, we really didn't have these kind of resources, but it's good to know that we have them now. But I wanted to ask, how's your outreach like with the schools and the high schools in particular? Do you guys, go out there, kind of, spread that campaign there with the 988? Are they kind of aware of that, or how's that been so far?
That's a great question. Yeah, we have like in the past, even prior to 988, like with suicide prevention, like we've done a lot of. We have like I said, September has always been that event where we do, but as I've said in the past, and services that we have provided for our high schools, and like I mean, when I also remember when suicide prevention first launched, and even now with 988, um, there've been deaths, and now
Mhm.
that impacted some of our students, our high schools, even more recently again. But with all that, we have provided. I'll say, yeah, there have been a lot of resources provided. We have done the trainings for all of our school counselors, and I know even for PSS themselves, they have the Project Haligi, the mental health. But what I've observed, and I've say in my 6 years of, um, even though the students are aware of the resources, and I'll say something more close to home, where the individual that we've lost, a student that we lost to suicide, there were, I mean, it comes to that, right? There was messaging going on. There were a lot of they were aware of. But the thing is, like we always said, and we've done in many of our trainings again, and provided that training for our counselors, and it comes to that, if only they just reached out, someone had just,
Mhm.
whether it was at the time 988 wasn't available, but
Mhm.
they were aware of. I mean, there are some that we're fortunate. There was students that did see things or hear things or notice the comments on whether it's the group chats or
Mhm.
and did message the principal or a school counselor or
Mhm.
a trusted teacher or even a parent, right?
Mhm.
And so my thing is I'm saying is, yeah, we continue to provide whether it is the messaging,
Mhm.
whether it is, and I know what you're saying too.
I guess maybe one
Yeah, more
suggestion I would
outreach.
have,
Yeah,
because even me personally, right, I didn't know about 988, and a lot of obviously the younger generation on social media. So maybe a little bit more focus on that, even just simple um, advertising, right?
yeah,
Because even with me, right, there's certain stuff that just pops on my phone that obviously are paid ads, and that's one way to get that message out, to them. And then also, I also recently met with the middle school too, right? And middle school and elementary, they're also having mental health issues because of bullying, social media, things like that. So, is that something that you guys are trying to address as well?
We're working on that. So when the school opens, um, we're going to be presenting at the PTSA meetings and also to the students. So we're working on it now. We're slowly reaching out we're presenting to the community. So like I said earlier, we're a lot of people don't know about 988. So we're slowly scheduling, and we'll be doing presentations at the schools, even for private schools, when the school resumes in August.
Oh,
So
thank you. Yeah, I'm glad that you guys reached out to us, because at least now we're aware and we can use our channels as well to
yes,
spread that out to the school. So thank you guys for taking the time to come here today.
you're welcome.
Rep Yaktama, go ahead. Thank you for the question.
Thank you, Speaker. Um, is this number 988 assigned only to the CNMI? Can someone, or is this for all over the world? So someone from Hawaii or California can call 988
yeah.
for this. Oh,
Yeah,
okay. So
so
it's all over.
yeah, like all, I mean, for us, ITD is our provider, right? So like we said, when we clock out at 4:30, because at 7 o'clock, try to, so the calls are routed to the system we call Vibrate. So the way the technology is, wherever, if you're calling from Hawaii, or if you're calling, say, from here, right, route us to the closest, supposedly. But I've heard from others. They said that when they were routed, they were talking to someone in Ohio or even Texas. And then some of the feedback we've had is others that have called the 988. They're more. I mean, yeah, they're glad that someone did answer on those times, but they'd be more comfortable to talk to a responder from. So sometimes when we come back to the office, then we'll get or follow through that or someone else reached out, but they were wanting to. So they'll call back when we're in the office. But yeah, the 988 is all 50 states. All and
I want to add to that. So if you're in, let's say, Texas and you're calling 988, you'll be routed to the nearest crisis center that's registered for that particular zip area code.
area code.
Yeah.
Okay, thank you, Pastor Fred and Lorenza, for your presentation. But since how far back did we start 988, or was it when did the program roll out here in the cinema? And since then, what's the volume of calls and stuff, or how often are you guys engaging with I guess clients or callers for crisis counseling or crisis management, and even in regards to suicide ideations and stuff?
So our volume number right now is, like I said, it's quite low. But even when numbers that have been the calls are being routed, there are calls coming in. But I mean, yeah, we're small, 48,000 our population. But there are still calls that do come through. But for us, that when we're capturing those calls, our call volume is still very low. And sometimes, there's a tendency we've had prank calls come through.
Okay.
Even one time, our team was presenting, and while presenting, someone did actually call 98 just to test it.
Just to test it.
But so.
But are the calls coming in local, like the ones,
Yeah.
callers with engagements? Okay, thank you.
So a lot too is just to do with an inquiry, or sometimes even a third party that calls up just to ask about it or calling for somebody, and then they'll share it, but we don't get the call from the individual that they're asking for.
No, I just asked because you mentioned also, like, the stigma in our communities from close-knit family and stuff. So I just want to see if the services is available, but just how is it being utilized by the...
I'll say, like, what was mentioned earlier, right? 988 is still unknown. And I'll say, just coming back from our recent conference that we had in Chicago, and then I was in DC just a few weeks ago. Still a lot, even our assistant secretary for SAMHSA still mentioned there's still many that still don't know about. So, and answering what you said, we're still 2 years. We're just now 2 years statewide, So they're saying, and they're being honest too. Like I said, if it took 911 like decades, they're saying decades. So it's not going to be a sprint; it's going to be a marathon. But the key thing is now we have this resource that's available, because it's obvious, as is mentioned, mental health issues is on the rise. But still, at the same time, I think there's still a lot of stigma. Mental health and suicide is still a very sensitive subject matter. Not just, I would say, not just for our island, but I think
Everywhere.
but it's still a human issue to address, into mental health and suicide.
In regards to the launching, the cinema launched, the 988 here in the cinema launched last year on April 17. Any more questions?
Thank you for your presentation. And you're right, a lot of this is very sensitive. But the biggest challenge for our people, especially for Rhode Island, because it's a smaller community, it's harder to speak to a counselor or a specialist, because the fear of everybody else knowing that they're going through mental health issues. So is that something that I understand that the trunk line distributes out to all the areas in regards that's the 670 area codes connected to, right? I know it might be easier for them to talk to somebody maybe from Guam rather than from the cinema, because they understand better because they're a neighboring island, but they also know that this individual doesn't live on Tinian, doesn't live on
Yeah.
Saipan, doesn't live on Rhoda, for them to share their issues. 'Cause I think the biggest thing is a lot of people are going through this. There's only a few that are confident enough to press forward to talk about it, but there's a lot of people that would want to do it. They're just ashamed that other people would find out that they're going through it. So is there something that we can consider, I guess, with this trunk line system, if we get to the 24-hour service, both to Cinema and Guam, is whether we can trade off our population when it comes to talking to a professional, whether a professional from Guam rather than a professional from the Cinema, because of that fear that the information might be exposed. Is that something that maybe down the road, like you said, Pastor Fred, it's a marathon, it's not a
Yeah.
sprint, but I think it should be something we're considering now, because that's always going to be the fear.
Yes.
I mean, we went through this with the CGC during the big ice pandemic in the 90s, that a lot of the individuals that actually went in were frustrated because how did other people from the outside were finding out that they were, you know, recovering drug addict, you know. So I think that's the
Yeah.
biggest challenge.
Yes.
It's to be able
That's
to
true.
to have that personal information be protected
Yes.
and be confidential to that individual and whoever the professional is.
I think what do you say? The coconut wireless is much stronger than any of what we. I mean, even during the pandemic, I still remember when I was stationed at the Kanoa when we first found out right with the first positive case. You know, it was already out of the community before the actual official announcement was being done. So that's always the biggest. I think it's a really great question, and it's always the biggest. Probably, I think one of the biggest concerns because it was such a small. Even here, that's a great. I know we were trying to introduce telehealth as well, whether, but even that, like to come to, I know in the past too, even them coming to, even though not having our office situated in a very more of a not near the hospital and all that, but even just having them coming to an area where it was very, I'll say, try to be discreet or be remote, but those are always the biggest, the challenges that we, but those are great suggestions and something we can really work with our clinical director and even try to provide. Because I know for us right now, it's the calls. I mean, the calls do come in. Like we don't record. Nothing is captured. Even though the calls that are, nothing's recorded. The system doesn't record any until at least the individual that's calling is really, the responders will work with them, to try to, just work through whatever the screening that we're doing, the assessment that we're doing. And then if they're really agreeing, to maybe seek further, then that's where we'll probably try to take that information from them. But then again, we're letting them know, everything is confidential and nothing is shared, outside of until only with our clinical side, who we're making the
Unless
referral
we're
to.
going to do a referral to another clinic.
So the referral is the only thing that's recorded.
Oh no,
not
that's when we gather your your
If they're really
information.
wanting to give the
Okay,
information.
but see, that's the bigger challenge is
Yeah.
getting to that point
Yeah.
because an individual might need it, but there's not enough confidence in that phone call for
Yeah.
them to even say, I want to move forward to the next level, right? Because of the fear factor of getting exposed. And I think that's something that we definitely need to work on as a community where yes, we're very kind, we're giving, but when it comes to our personal issues,
Yes.
we definitely hold that back and we hide it because of the fear that everybody else knows that we have our own problems, right? So I don't know. It's something that we can
that's
work on,
true.
but at the very least, this is available and there's a starting point somewhere.
Yes.
And if we need that to go forward, I think that one of the things is the initial call should be recorded at the very beginning, like up front, like kind of like calling a bank, for example, right? And your call is being monitored and being recorded for like stuff, something like that, just so that that initial call might be that period where this person is actually crying out for help, but you don't really see it through the voice, right? So thank you for that.
I forgot to mention, you can also call as a third party caller on behalf of someone. Yeah, you can also do that through 988.
But what if that person doesn't know that you're calling on behalf
No,
of
you
them?
have to get the permission. from
That's-
them.
see, that's-
Or like, for example, your child, or sometimes, like you said, they don't have the courage, but then they'll agree. They agree that someone, let's say a sibling or
An
a family
adult.
member, calls on
Does it
behalf.
have to be an adult?
We've had callers under the age of 18.
Yeah.
Okay.
So yeah, we've had, that's what's been a big concern too with local laws, and because usually with our federal side, they said if the caller is a minor and then wanting, we should still respect that and keep but for us here locally, if we're gonna say if that youth wants to just receive services, and then legally, we cannot, through, because we're working with our clinical director, and as well as, things like, because even some of the schools said, is it okay that you guys come and provide, once we make a referral, to go provide the service for that youth, but legally we cannot provide, because it's a minor, and, that's over the,
But the
we have to
local
have
laws
the
preventing
consent of parents to.
the local laws preventing you guys from accepting it.
To provide,
Yeah.
to see the minor and provide like further, without
Consent.
parent consent. Yeah, those always are things that if
Okay.
that
But the
we're kind of-
federal law allows you.
Allows.
for the system says we can talk with the youth on, when they reach out 988, and the respondents have provided, without even taking any information. They're just sharing but then if they're wanting like for a face-to-face, they don't want, because that's where the mobile crisis, that's the phase where those can go out, whether it's a provider, whether it's a therapist or a mental health counselor that will go out with one of the team, or like a peer specialist that can go to respond to. Then our guidance from our clinical director says, we've got parents need to sign off or give consent. Even if we go to the school, we have to get the consent.
Sure,
the
but what
parents
does the
to-
regulations of this grant allow you to do? Because at the end of the day,
Yeah.
this is
Right now, it's just
100% federally funded,
for
right?
Mainly it's the calls, the response on taking the calls, and but then also the next phases is because the third one is going to be like what we call life centers or a crisis center, where would be an option for them to go to rather than the emergency room, or rather than we have the psych unit.
Sure. I'm just saying, because this
yeah.
100 federally funded, correct?
Yeah.
And so if the regulation allows you to that level, and they're saying that the local law supersedes,
Yeah.
so that would mean that if we come up with a local law that says you can do this, plus we can use the money to do something else, they would follow the local law, or would they restrict it to the federal side?
They will allow this. They will still say the local law still supersedes like whatever the federal is.
Okay.
They're still like what we get from from project officers, and they said, we're recommending this and this, but in whatever our
Our laws supersede it's what they're saying.
yeah, that's what they're.
So do you have sections that we may need to amend to allow some flexibility? Because if they're giving up the authority to our side, then we should have authority also to how the funding is used.
Creating,
right?
like for us, right? Like even when it comes to the crisis response, then that's where we're creating a MOU with our first responders. So that's already been drafted, and there were things that with our clinical director, then with our AG's office, or our legal counsel, just to review through what is even something that from our federal side has created. And there are certain things that they look through and will they give a recommendation to us. But then even for here, our clinical director and legal counsel will review as well.
I do
within the
understand
area
that.
just to create that
But we're saying
guidelines,
that
for our,
they're saying that you need parental consent to assist this child, for example, right?
for them to
but-
call, it's all right, but then when they want the referral,
That's what I'm saying,
yeah.
though. If it's for them to call and they're saying that our local laws would supersede their federal laws, that would mean that even that phone call doesn't hold any water because it's a minor calling and the parent's not giving consent for the minor to call a mental health hotline. All right. So, I mean, if there's something that we need to change, we should work with you guys to change the law, but provided that we're also able to tap into those funds for other issues here into the cinema.
Because it comes to that too. There's I guess when it comes to the sustainability of this,
Yeah,
right?
yeah,
Because the grant will end. Well, for us, right, the grant ends 2026, and then of course, what we look, as federal does, right? What can be provided to see the sustainability where?
Sure.
Because I know other states, I've listened to they've created it's almost like a fee, right? So any like a 911 call that's being done, right? There's a fee that's charged to, or not a fee, but I guess all of us that are with the Docomo or ITNE, right? There's just a little
Sure.
tax, something like that's put aside or is designated for maybe I guess the sustainability of.
So do
of
they
the
consider
crisis,
the funds that are going to Docomo and ITN as indirect costs, or is the indirect cost being kept by the office?
Yes, no, I mean it's part of our the funding that we, because like us we've gone with ITNE, so that there's a part of our grant that goes to them, but then also there's an indirect cost, but it's with the hospital side, well,
The hospital keeps the indirect costs.
Yeah.
Okay, so then I guess one of the things that we need to do is amend the law and make sure that indirect cost goes to you guys, and then allows the services to charge outside, right?
that's the
All right, thank you.
good question.
I just gotta take off. But just to clarify, you guys do provide services to like first responders, like the fire. Do you guys do outreach to them, or?
Oh, for like what we're doing
Mhm.
today? Yes. We're going to reschedule. We're going to reschedule with the DFEMS because I think we were supposed to reach out last week, but then they had a
Yeah.
call. So
Oh, okay.
yeah, but we're working with them. Even we've reached out to DOC, and Fred is going to be working with GPS.
Yeah, I think it's
What-
vital too that
What are you saying?
Yes.
Services? Are you talking like
just as far as like outreach and
Oh yeah.
because I know predominantly they do deal with traumatic stuff, and a lot of times maybe they wouldn't want to open up, like you said, especially male predominated fields. It's tough for us to open up sometimes, but I think just knowing that you guys are there and they can tap into you at any time, I think that's something that's crucial, and as well as veterans too. I know when I was working with the governor's office, we tried to reach out to the veteran community through town halls, but a lot of them, just did not want to come out. They don't want to be seen. They don't want to be, like Rep BJ was saying, they don't want their business out there. So I think maybe reaching out to them directly, just to, check in, make sure everybody, they're doing okay. I think those are vital services that they might need. And also they should be considered, because I know with the ones that did come to the town halls, they were saying just a lack of support sometimes, and also not being able to talk to like a specialist or somebody on island. It would have to be through video calls, or they would have to go through Guam, and maybe how we can help with that kind of support for them too. But yeah, those are just some things to think about. But thank you guys again.
It was great because I know with Representative Omar, we're working with the Governor's Challenge, and there's a in that regard, it's the Governor's Challenge is more veered like suicide prevention programs and campaigns veered towards our veterans. So that's another project we're working with Joaquin Villa Gomez and trying to get that. And I know we're thankful we have certain veterans that have. I know they have their own groups or associations, but some of them have even created. There's a nonprofit that they're I think Project Buddy Check. I believe I can't remember the name that they're Buddy Check, but yeah, that's really great. That and again, like that's the biggest challenge. They're going to try to avail of some of the things that what we mentioned, suicide prevention trainings and programs, and even so, I believe there's a grant that's available for them too in this area. So yeah, we're working, with our federal partners to try to get that launched, because I know Guam has it now, and they got, and we're thankful to Guam. They were the ones that reached out and told us, hey, there's funding available as well for the veterans in this area. Yeah. Yes, I guess we would just have one few things. We're gonna just evaluation, please, just for our data purposes. Just please be honest and share some of the concerns. And there were some great ones that were shared today by our representatives. But Zeus Masi again and Olumwai.
Before we wrap up, any questions from the staff that you guys would like to ask, or are we okay?
I will give you a raise if you ask.
Oh my goodness.
But please, if there's a training that you guys do want to avail, we do provide that, and sometimes I know depending on schedules too, we can provide the venue and lunch on us. We can work with doing that. So that training can be made available to the staff as well, and of course our representatives.
In the last year, crisis centers have responded to nearly 5 million contacts.
It's a number we should all learn in case we or somebody we know are in need.
I'm James Brochet with the Baltimore Ravens. To talk with a caring call specialist, call or text 988 to connect with the National Suicide and Crisis Lifeline.
But the line isn't solely a suicide intervention resource.
It's also for people who are struggling with depression, substance use, other types of behavioral health, mental health crises, any type of crisis, anyone who needs help.
It's a way forward. It's someone who gets you.
If I had 988, it probably got me to a healthier state faster.
It doesn't take much to be able to reach 988 now. Call, text, chat, and it's working.
I think that's what 988 really helped me with, was realizing that I'm not alone. I don't have to be alone to do this.
This 3-digit national hotline phone number for suicide prevention went live in 2022. What is 988?
It looks like you have a cheering section with you today.
I'm here with the D.D. Hirsch 988 line, the suicide prevention line.
Get you. You could do anything.
Crisis work is important because we have to take care of ourselves mentally like we do physically. I may need someone to talk to, so let me pick up the phone and dial 988.
I think of us as the foundation of a lot of other services that somebody might access.
While Googling suicide, he saw an ad for a phone number he recognized, 988.
They literally were my best friends.
The National Suicide and Crisis Line is now etched on ICPD vehicles.
Working with public safety, they have that direct access to connect to us.
It's important for police to be trained to recognize signs, symptoms, and behaviors.
It's our goal that whenever we become aware of a person in crisis, that we provide them with the proper care, treatment, and resources to ensure that they don't end up in that same crisis again.
This is the first time that I can recall in at least 26 years of my career that every single state and U.S. territory is talking about their behavioral health crises.
Our mobile crisis teams are really important because they can respond just about anywhere in the community.
Now the program is expanding, having counselors on hand who speak Spanish and those who specialize in helping LGBTQ youth.
You're not being able to get help in a crisis because you don't speak English. 988, the National Mental Health Crisis Line, is trying to remove that hurdle.
This addition will open doors for Spanish speakers.
The National 988 Suicide and Crisis Lifeline now includes American Sign Language services for deaf and hard of hearing callers.
When someone is speaking about their pain, their emotional, mental pain or circumstances,
It's important for them to be able to express this in the way that they feel most comfortable.
We are going to be there for you. If you do try to reach out to us, 988 en español o 988lineadevida.org. We'll be there. We'll talk. Estaremos allí. Hablaremos. Ayudamos.
I want to say directly to LGBTQI plus kids, you are loved just as you are, just the way you are. And if you're feeling overwhelmed, you call 988, the National Crisis Hotline, and dial the number 3 to talk to a counselor who has been specifically trained to support LGBTQI plus kids.
Having a line that's specific where they know it's going to be safe. Folks have been trained appropriately on, proper use of terms and understanding sort of the differences in folk is really, really important.
So I want to let everybody in the deaf community know that 988 video phone is here. Come on, bring it on, use the services. We are so thrilled and excited.
It's really time that we make suicide prevention front and center. We highlight its importance.
It's hard work, of course, but it's super rewarding. Being on lines with people who are, going through a really difficult time.
Everything about this role is rewarding. Every day I get to help people.
This work matters because people need to know that there are people out there to help. There are places that they can go. There's someone there to listen 24/7 and to help them to know that they're not alone.
Call or text 988 or visit www.988lifeline.org for the Suicide and Crisis Lifeline.
I think one thing we just want to request a group photo. Is it okay, House Speaker? And thank you.